I'm very proud to be the first African.
The head of the World Trade Organization says Africa is working with the European Union and other partners to help create regional vaccine manufacturing hubs in Nigeria, South Africa, Senegal, and Rwanda. Director General of the WTO, Dr. Ngozi Okonjo-Iweala, disclosed in a virtual meeting that over-centralization of vaccine production capacity is incompatible with equitable access in a crisis situation.
First and foremost, we need to focus on the issue of COVID-19 and what can the WTO do to contribute to solutions. It needs to work with the WHO, with the COVAX facility, with the ACT Accelerator, all these organizations that are trying to accelerate supplies and vaccines to poor countries. The WTO, one, can look at export restrictions and prohibitions from members. The International Trade Center says there are almost still 100 members who have these restrictions and prohibitions. How can we lift them and be very transparent about them, making them temporary so that there'll be a freer flow of goods? Secondly, how can we also encourage finding what I call a third way in which vaccines can be manufactured in many more countries whilst taking care that we don't discourage research and innovation, which is linked to intellectual property rights. So this is an area of work.
Africa is facing a major shortage of coronavirus jabs, and the United Nations has urged countries that can donate surplus supplies to the continent to do so. India and South Africa had approached the global trade body in October, calling on it to waive part of the agreement on trade-related aspects of intellectual property rights on COVID-19 vaccines.
The Africa we want. The ability to manufacture vaccines, medicines, and other health-related commodities will help put Africa on a path to self-determination. Through this initiative and others, we will change the narrative of an Africa that is a center of disease and poor development. We will create a narrative that celebrates our successes in reducing the burden of disease, in advancing self-reliance, and also advancing sustainable development. This will enhance our capacity to take responsibility for the health of our people, for the health of Africans. We will be able to plan for the entire value chain, from training a critical mass of young people, enhancing and maintaining our supply chain, and ensuring the efficient use of medicines. As South Africa, we intend to pursue these objectives in close cooperation with other countries on the continent, enhancing regional trade and investing in science and innovation.
The countries argue that the suspension of rights such as patents, industrial designs, copyright, and protection of undisclosed information would ensure timely access to affordable medical products, including vaccines and medicines, or to scaling up research, development, manufacturing, and supply of medical products essential to combat COVID-19. In another development, the Director General of the World Trade Organization, Tedros Adhanom Ghebreyesus, says the World Health Body is in talks with groups to establish a technology transfer hub in South Africa, with Afrigen Biologics and Vaccines acting as the manufacturing hub and a training provider.
The inequitable access to vaccines has demonstrated that in a crisis, low-income countries cannot rely on vaccine-producing countries to supply their needs. We haven't seen it before with HIV, when people in low and middle-income countries couldn't access life-saving antiretroviral treatment. We have seen it with diabetes, where insulin is priced high despite having been around for more than a century. The COVID-19 pandemic has shown that relying on a few companies to supply global public goods is limiting and dangerous. To boost manufacturing, WHO has continued to call for the sharing of know-how, technology, and licenses, and the waiving of intellectual property rights. Enhancing local production of health products has been an area of focus for WHO for several years, but the pandemic has brought it into even sharper focus. Just a few weeks ago, the World Health Assembly adopted a landmark resolution on strengthening local production of medicines and other health technologies to improve access. And today, I joined the World Local Production Forum, which aims to strengthen production capacity where it exists and to build it where it's lacking.
The Director General added that Africa Centers for Disease Control and Prevention will provide guidance through the Partnership for African Vaccines Manufacturing. In April, the WHO called for proposals to establish technology transfer hubs for COVID-19 mRNA vaccines, which teach manufacturers in low and middle-income countries on how to produce certain vaccines and give them licenses to make them. Kamal Sadiq reporting for CBA TV.